a surge in ill health across England having a huge impact on the NHS, according to a new study from a leading health charity.
The Health Foundation found that by 2040, 9.1 million people in England will have a major illness. That is an increase of 37% compared with 2019.
Well, by comparison, the working age population projected to increase by only 4%. That group, of course, responsible, it said, for generating the bulk of revenues for the government to fund public services, including, of course, the NHS.
Cases of dementia are expected to rise 45% by 2040, heart failure by 92% and cancer by 31%. Extraordinary predictions there.
Well, let's get more. Joining us now, the Health and Social Affairs Editor of the Sunday Express, Lucy Johnston. Lucy, talk about trying to cheer us up with all these figures, but I guess it's something that perhaps the NHS has been tracking with social and economic conditions as well, you know, particularly things like diabetes and poor health because of diet.
I think you've hit it, actually, right there. So the NHS is sort of struggling to survive, isn't it? And many of the things that were cited in this report are linked to poverty, so the social determinants of health. And we know that this country, the UK, is more expensive than most of the rest of Western Europe now and most of the rest of the world. So childcare costs, housing costs, transport costs, costs to be a student, food costs, they're all much higher than many other parts of Europe, and people are struggling to survive. And I mean, obviously, ageing is one factor that leads to increased illness, but also poverty and ill health are married. And one of the reasons for looking at this projection, you know, one of the causes of this is these social determinants. And the government needs to start looking at really revolutionising how we deal with healthcare in the community. We've got figures showing many people, millions of people, or about 1 million people waiting 4 weeks to see a GP. That's part of the problem. But also we've got people, about 3 million people, I think, are living in houses unfit for human habitation. And there's some figures out today showing that there's been another record rise in the number of people living in temporary accommodation. So kids living in beds together, 3 in a bed, living in overcrowded spaces, in mould, with no access to natural life. These are the things that lead to ill health. And when you're stressed, you're more likely to eat badly. You may not be able to afford healthy food. And these things are linked to obesity and diabetes. So this is where it's got to start. I don't think the NHS is able to cope with these problems on its own. It simply can't. So we've got to look at how to improve health and public health.